Sleeping pills are a very bad idea. And that's not my personal opinion. Dozens of research studies going back to 1979 show us that there's an increased death rate amongst people who take sleeping pills. There's increased dementia risk and so on.
What if the truth came in a gel cap and we could just pop it in our mouths and forget about it? Well, it doesn't, and we can't. But we can laugh in the face of reality while plotting our survival. Welcome to the Truth Tastes Funny podcast. I am your host, Hirsch Redpoon, and if my guests can handle the truth, so can you. Open wide, folks. Here it comes. My guest today on Truth Tastes Funny is Dr. Lucinda Sykes. Lucinda's a retired doctor, a longtime teacher of mindfulness. And since 1997, she's directed meditation for the Health Clinic of Toronto, teaching medical programs of what's called MBSR, mindfulness-based stress reduction. And more than 6,000 people have attended that clinic and been referred for help with their many medical conditions worsened by stress. Since retiring from her medical practice, Lucinda continues to speak publicly about medicine's overprescription of sleeping pills. Women 50 and over are at special risk, and we're going to talk about that to start off. But thank you, Lucinda, for coming on the show.
Thank you, Hirsch. I'm very glad to be here.
It's wonderful to have you. So let's jump into this sleeping pill controversy or conversation, you know?
Yeah. Sleeping pills are a very bad idea. And that's not my personal opinion. Dozens of research studies going back to 1979 show us that there's an increased death rate amongst people who take sleeping pills. There's increased dementia risk and so on. And plus, given the topic of your podcast, people who take sleeping pills are more prone to depression and even suicide. They are just a darn bad idea.
Now, what was a lot of us have some vague idea, but what was the origin of sleeping pills and what's in them for the most part? When you're talking about the adverse effects, what chemical constitution are you talking about?
Yeah, so I'm using this popular term, sleeping pills, to refer to the most popular forms of sleeping pills. So technically, you would be talking about benzodiazepines and benzodiazepine agonists. So it's a range of different pills that all act on what we call the GABA system of the brain. Now, that's a mouthful. We won't go further with the technology unless you want me to go there. But basically, the GABA system of the brain decreases brain activity. It slows the brain down. And one scientist even says that it shuts down the brain. Now, so when we stimulate the GABA system of the brain, it is true that the thinking mind tends to shut down. But the problem, Hirsch, is that all the other functions of the brain also are reduced. And when we are sleeping, we need the brain to be active. We tend to think when we're sleeping, hey, the brain is taking a rest, but it is not. The brain has a lot of work to do for us while we are sleeping. In fact, at some points in the night, the brain is just as metabolically active as it is when we're wide awake. It's just that it's not giving us the story mind, so we are asleep. But the brain is busy cleansing itself. The brain is busy boosting our immune system. It's helping us lay down memories, and it's giving us some of that inspired and creative thinking that you may have noticed you have when you wake up in the morning and you've sort of solved problems and so on. The brain is doing all of that while we're sleeping. It's also giving our cardiovascular system a big rest, and it's helping our endocrine system to balance too. That's a whole lot of activity the brain is trying to do for us while we are sleeping. The
Very
problem
interesting.
is,
Oh,
yes, well,
no.
the
Yeah.
problem is that the sleeping pills suppress that.
Yeah.
That's
Yeah,
a
that's what I
that's
was
bad
going
news.
to say was, I rely on I sometimes, not just because I'm in my 50s and I'm older now, than I was when I was younger, but I really look forward to sleep as that rejuvenation
Yes.
process because I'll get emails toward the end of the day or the evening, and people are asking me questions and they want really, thoughtful answers, and I'll say, okay, I'm going to sleep. I'm going to go to sleep. When I get up in the morning, it's all going to be fresh. I'm not going to be burned out. I'm going to be rejuvenated. But if I were taking sleeping pills to aid in that sleep, I wouldn't be getting
No.
that reboot, right?
Absolutely right, Hirsch. That's the problem. The sleeping pills are sedatives. They don't really give us natural sleep. And it's the natural sleep that gives us all the good stuff. The inspiration you have in the morning, suddenly you figured out problems. That's not available to you if you are taking sedatives. That's what the sleeping pills are. They're sedatives and they are suppressing brain activity. So you're
Yeah.
not going to get that.
Now, as a mindfulness teacher, um, and also, how did you come to that, to be teaching mindfulness, and what does it
Oh,
mean to you?
well, I come to it honestly. I've been practicing mindfulness and yoga for decades. I had sleeping problems very early in my medical career. I grew up in Alberta, that's a rural part of Canada. I
Sure.
grew up there and then I came to Toronto to go to the big shot medical school. Praise be, what a great place. But I began to develop insomnia, and my mother and my grandmother before me had suffered from insomnia, and so I really had to do something. And long story short, I got some psychotherapy. I took up meditation and yoga, and praise be, I sleep well now. But I was moved to it those decades ago, and I've never given it up. So I
Yeah.
can personally advocate for that, but I would not encourage people to think, oh, I'm going to practice a little yoga and help my sleep problems. One doesn't want to think of them as modalities to fix this or that, but they
Yeah.
certainly will help you if you do turn to them over a long period of time.
Now, to what extent do you hold, let's say, the pharmaceutical community responsible for the overprescription of sleeping
Oh,
aids?
well, you see, now I'm retired, so I can be more forthright in expressing my opinions.
Right.
Um, in a broader sense, I would offer that the pharmaceutical industry has undue influence on medical practice. And the overprescription of sleeping pills is, one symptom of that, that medical practice has been uh, kind of debased to dispensing pills. And there
Yeah.
are many much better ways to help with sleep problems. And nowadays, medicine is slowly but definitely moving to advocate for psychotherapy forms of sleep aids. But still, the prescription of sleep aids is easy. One sociologist was investigating what is called the medicalization of ordinary life, how ordinary uh, issues in life are becoming medicalized. If you think about it, sleeplessness itself is not a medical problem.
Right.
We all have sleeplessness from time to time. That's what Shakespeare told us. It's part of the human condition. It's not being
Yes.
sick. But through the decades, sleeplessness has become medicalized. Well, a sociologist investigated this phenomenon in an interview that he recorded in one of the papers published. He had a physician saying, well, sometimes it's easier to write a prescription. It's often easier to write a prescription for a sleeping pill than it is to counsel a patient as to how they can improve their sleep.
Well, that's a wonderful point because uh, the idea of, you know, the problems can be solved with with what do you call it, with medical means, is kind of a a misnomer.
I agree.
It's not, and this happens with kids. This happens with
Oh, yes.
with kids, and their and the the ADHD and all this
Yes.
other stuff. So when it comes to sleep, when it comes to what constitutes a sleep issue, what do you think constitutes a legitimate sleep issue, and how would you suggest that we combat it?
Well, there's nothing wrong in discussing it with your physician, nothing
Right.
wrong at all. But you would hope to have a physician who is sensible. And certainly in the psychiatric lexicon, a person does not suffer from insomnia disorder unless they've been unable to sleep 3 days a week for 3 months. Now,
Mm,
that's a pretty high order. Whereas if you're having some work stress or little problems in the marriage, that kind of thing, you're having a bit of sleeplessness. Well, I'd say you're kind of having ordinary life. And there are ways, definite ways to help yourself. And you do not need to burden your brain with sedatives. That's what's crucial, especially because once you start taking sleeping pills, they can be darned hard to stop. You get a
yeah.
withdrawal insomnia. In fact, the research suggests that taking sleeping pills for even a couple of weeks, then your sleep is worse after, at least for a while. And that's quite pernicious, especially if the physician does not explain this to the patient. And instead, the poor patient thinks, oh gosh, I took those sleeping pills for a couple of weeks. And now I think I've got even worse insomnia. I can't stop. Maybe I should even increase the dose. Uh, Understandably, the patient doesn't understand about withdrawal insomnia. The physicians should, but they don't always counsel their patients.
Yeah. Yeah, that's the other thing, is that I think there's so much that's they're doing prescriptions, but they're not spending time talking about problems. And that's, I think, now let me ask you this, maybe you have some insight into this. It's okay if not.
I may
Um,
have opinions anyway, Hirsch.
well, yeah, and perhaps you have opinions. Uh, Here in the United States, we have a new administration that just came in. Robert F. Kennedy Jr. has been appointed as the
Oh,
Director of Health and Human Services. That's obviously, all the appointments are controversial,
yes.
but what is your insight on that, and what do you think might kind of pretend for our situation here?
Well, I think I'm at my strongest when I stick to the research. And when I tell you what the research shows about sleeping pills, for example, rather than to stray into the politics, especially at such a fraught time, it's,
Hmm.
my political opinion is sort of like the layperson's political opinion. But the research I know very well, I know very deeply, and the evidence is well, one can't argue with it. Sleeping pills are dangerous. They shorten the lifespan. We have study after study that shows that the life expectancy is reduced by even 5 years amongst women who take sleeping pills. Astonishing. Or that the death rate in certain studies is doubled amongst people who are taking sleeping pills. This is what I really want to publicize. I want people to understand that sleeping pills do not help you sleep. They do not induce sleep. Rather, sleeping pills are actually sedatives. And in this lexicon, this category, sedation, alcohol too is a sedative. Barbiturates are a sedative. There's a range of different substances that sedate the brain, that shut down the brain activity. that's very different than your brain deciding, hey, it's time to sleep. And then your
Hmm.
brain fires up, and it's kind of complex how the brain does it. The brain fires up eventually a series of brain states that cycle through the night. Your brain does it orchestrates the dance of sleep through the night. And there is no on off switch to this. That's
Hmm.
the misunderstanding. People think of sleep as having an on off switch, and they believe that just because the mind is not active, they believe that sleep is happening. But actually, they may just be well sedated, and the poor brain is doing its best to give them a refresh, but it can't do that when it's burdened with these chemicals that are sedating it.
Right. Now, and I've always been a someone that dreams a lot. I have
Yes,
a lot of dreams.
what a resource. Yes.
And what I used to think is, well, if I'm dreaming, I'm not resting.
Oh,
But that's not really the case, is it?
no, no. Your brain cycles through a period of dreaming at least 3 or 4 times during the night, and your brain is rebalancing in some way. Different schools of psychology, different approaches in neuroscience would give different explanations for what dreams are about, but there's no doubt they are helping the brain to rebalance. And further, they are supporting you in that which you observe. You wake up in the morning, you are refreshed, you have a clearer sense about what life is about. You've even maybe figured out a problem you went to sleep with. The dreams are
Yeah.
involved in that process.
Do
Thank
you have,
goodness.
yeah, do you have a take on um, the meaning of dreams or
Oh
any of that
gosh.
element?
Wow, what a question. I'm trained in Jungian analysis. I was in
Hmm.
Zurich for 7 semesters, and I mentored with two of the great Jungian analysts for 10 years. So that's quite a synchronicity, as Jung would say, that you'd ask the question. Yes, I
Yeah.
do have a perspective on dreams, most definitely. I offer, in my consulting, I do offer dream analysis and so on, but I wouldn't offer that in detail here because people divide into different camps. Maybe you're
Yeah.
someone who's really benefited from cognitive behavioral therapy, and in your world, you don't even think there is an unconscious. And well, why would I argue with you on that sort of philosophical point? You've been helped by CBT, and I would say I'm very glad for you, even though I don't really ascribe to that viewpoint. But Jungian analysis, dreams are a foundation to the work, in fact.
Well, I'm coming from a place of kind of open-mindedness and curiosity, and
Yes,
someone who just remembers their dreams. Ever since I was a child, I
yes,
remembered dreams, and I'm curious now because at this point in my life, for the past several years, um, I have had what I would consider to be thematic dreaming
yes.
experiences.
Oh, yes, yes,
You know,
yes,
dreams that which wasn't the case when I was younger. But
yes.
as I've gotten older, I'm like, okay, well, now a lot of dreams have to do with travel. A lot of dreams have
Oh,
to do with open spaces in the seeing the travel or the flight. It's often air travel, seeing that journey from the exterior of a plane,
yes.
let's say. What does that say to you?
Well, it would be irresponsible of me to kind of say something off the top of my head about you because
Yeah,
I don't know you. But in a general way, I would,
yeah.
well, from the Jungian perspective, you have something that the Jungians call the self. It's a guiding archetype, as they call it. Each of us is being guided from within. And
Mhm.
this force within ourselves cares about us and wants us to, as the Jungians say, individuate over the lifespan. It wants you to become the great person that you have within you. And you started off, of course, as a tiny baby, and the self has been guiding you all the way along. And it does this on many levels of yourself, many dimensions, but it offers dreams. And some people are blessed to have, you have a lot of dreams and they sort of speak to you in a way. And one would assume, at least again from the Jungian perspective, that they are meaningful and are trying to have a conversation. And we don't even need to figure it out, but rather we just need to be interested and to play with, shall we say, the metaphors that are presented. The dream maker speaks in metaphor, like air flight. What better metaphor is there for, expansion and going places and inspired thoughts and
Yeah.
if we pay attention to our dreams, the self, as we say, wants to be listened to, and it would like to get involved in a conversation. If you give your dreams attention, they will tend to speak back. But it's not going to be a computer printout. It's not going to come to you in a rational way. It will come to you through more metaphor, through more imagery. But if you are open to it, if you have an artistic sensibility, and as I understand you certainly do, you just honor it with your attention and see where it takes you. And you may not say, oh gosh, I really, really nailed that dream. It's really helping me now. But it's through your willingness to pay attention, to take it seriously, that you discover that your life continues to, shall we say, progress or expand. If you work with an
Wonderful.
analyst, then they'll put more thoughts to it and even cite quotations from Jung and so on, but you don't need that.
Right. Well, wonderful, wonderful answer. One final topic I wanted to touch on, exhaustion. A lot of people say, I will sleep when I'm exhausted, or sometimes I will work until I get it done, and then I will go to bed exhausted. Now, people who go to bed exhausted might feel that they have done a good day's work. They're exhausted, or who feel like they need to work until they get it done. What are your
Yes.
thoughts on that?
Well, I like to default to the research. And the research would say that it's valuable, indeed, even important, to go to bed at roughly the same time every day and to wake up at roughly the same time every day. The world of cardiology even says that's good for your heart, that keeping an irregular schedule is tough on the heart. So you give your, well, we know it with our children, don't we? The children, they have a bedtime. It's bedtime, kids, off to bed. And we're doing that because we love the little tykes. It's not only that they're getting in our hair, we know that they need to have their rest. And we need to care for ourselves in the same manner. In modern times, we have the risk of what we call sleep procrastination. And
Hmm.
yeah, there's even research papers written on this now. And that looks like scrolling through Facebook or watching endless Netflix. And you just kind of coast there. And the body doesn't get a chance to sleep. And you hardly notice because you're in your squirrel mind, in the hamster wheel, mixing
Yeah.
metaphors, in the hamster wheel of your mind, and your poor body's being ignored. He'd like to go to sleep, but you're not giving him the chance. Over time, that can exact health consequences, and it can certainly exact psychological consequences. For one thing, it would make you more prone to depression and even anxiety.
Wow. Well, thank you so much, Lucinda, for being here. How can people find you if they'd like to learn more
Oh,
about you?
well, you send me an email and I always get back to people. And the way to find my email address is to download Happy Sleep Secrets. That's my PDF of 7 ways that we can improve our sleep. And if you download that, then you'll be a member of my uh, email list. And you will get my email access with every email. You can send me an email and tell me what's what.
Wonderful.
And I'm very
Wonderful.
available. I'm retired now, so I really enjoy the interchange. And you're welcome to do so. You can download it at it's easy to remember, lucindagift.com.
Oh, that's
Lucinda,
wonderful.
that's my name, lucindagift.com. You go there, and there you get a chance to click on the button, provide your email address, your first name, and presto, the machines will send you the PDF. Now, I must warn my male listeners that my work is directed towards women, especially women over 50, because in my private consulting, that's who I focus on, is women over 50 with sleep problems. But you see, I'm very expansive. I love to help everybody. And by the way, Happy Sleep Secrets, although it is directed to women, it has a lot of pink in it, for example, the information is unisex. There's no information there that doesn't apply to the men. So if you don't mind a little bit of pink and flowers, there's good stuff for the men there too.
Thanks so much for tuning into Truth Tastes Funny. If you enjoyed the experience, please leave a 5-star review and share this podcast with your friends.